Well, you may be feeling quite uneasy right now. Stay in, go out, and what will you find when you head to the store? Empty shelves, folks walking around like it's the zombie apocalypse. Well, she's the voice of reason and calm. Dr. Victoria Kelly was with us last week, and she joins us via Skype again today with some ideas on how to keep our cool when the world around us, well, isn't. Good morning, Dr.
Right.
Kelly.
Morning.
So I did ask viewers for their questions because I think a lot of people have individual questions depending on their situation. So I want to start with one of the questions we got from a viewer. MH of Port Clinton asks, what kind of long-term effects could the entire situation have on all of us, and what should we look out for?
Yeah, I think that's a great question. And it kind of embodies what we're all going through right now, because we're living in the here and now, but we want to make plans so that the long-term issues don't come up. So it kind of embodies what we're all experiencing right now.
Yeah, and you're going to go more in depth into this question here throughout the course of this segment. Last week we talked about loneliness, right? So now I think we're really feeling that, right?
Yeah, absolutely. When people are quarantined, they have the guilt and the loneliness, and loneliness can be as deadly as smoking 15 cigarettes a day.
Wow.
So it's a pretty significant issue. But in the short term, if we look at it short term versus long term, the short term, we're all going kind of stir crazy or experiencing this cabin fever process. And so there's that. And then, of course, the long term effects. So with the short term cabin fever, when we're stuck in close quarters with people for a long period of time, you can feel anxiety, panic, sadness, even anger, emotional exhaustion, feeling kind of restless, pent up, and you can even have problems with irritability and problems with sleep and concentration. So it's not actually like a mental illness diagnosis, but it's definitely symptoms that are pretty normal to experience in a quarantine type experience.
I think we talk about cabin fever, during the winter time or maybe if there's a snowstorm, but obviously we're going to be in this situation for a prolonged amount of time. So how can we go about dealing with this cabin fever?
Yeah. In the short term, number one is to basically have a plan, set goals for yourself. It doesn't matter how little they are or how big they are, but have a structure and set goals for yourself. You also should at least get out of the house, maybe go for a quick walk or something like that, whatever is allowed. They have shown that getting out in nature can be very beneficial. It can actually promote cognitive functioning, promotes positive supports, and overall your well-being. And I think another big one is to maintain your normal eating habits. I think all of us, when we feel stressed, and then now our structure is gone, we're at home more, we have access, it's going to be really important to try to maintain that as a normal eating habit too.
Yeah, I'm definitely feeling that. I have this big bag of Starburst Jelly Bellies or jelly beans that, every time you kind of walk by, and I have noticed that in myself, grabbing a handful of snacks, it's like, stress eating, I guess.
It's difficult. And, a lot of times people, they all on social media, it says people are telling us to exercise, but I can't because I'm so paralyzed by the anxiety. And what is difficult is that first step. But even exercise in a situation like this can be helpful. So if you take that first step, you're actually doing something to decrease the anxiety. Because if you give your brain something to do, it will be more productive rather than be paralyzed.
That makes a
our
lot of
brains
sense.
are built to react to new fears like this, and that is what it shows. So the important thing, though, is that we do what we need to now, and also consider the longer term risks, as the viewer had asked. And the biggest ones are post-traumatic stress disorder. And what they have found is that any quarantine longer than about 10 days increases the risk of this. In addition to if you're a healthcare worker or in the front lines, or you're a caretaker, and then if you have a pre-existing history of depression. Another factor that we really need to be careful of, and the studies after the other pandemics that have happened around the world have shown that there can be an increased risk of substance and alcohol use disorders. So again, we're all stressed. We don't have a lot of access to be able to go out and do things that we normally would do to cope. So what do we have access to? Some unhealthy things at home, perhaps.
Yeah.
And then the other thing is to be careful of agoraphobia. Now, agoraphobia is an anxiety disorder, basically where your brain perceives everything to be very anxiety-provoking and unsafe. So often open spaces, going to shopping malls. So right now, we're all experiencing this fear of, if we kind of make it on an easy to understand level, cooties, right? So, we don't want to be around people who have cooties. We don't want their cooties. And so when we do go out, we have this overwhelming fear that we can't do anything. Every place is unsafe. And for some individuals, being in a short-term quarantine like we're experiencing now can result in a longer lasting disorder like that. So it is important to have the right attitude right now.
Yeah, and I think that's one of your recommendations too. I think attitude and how we react and how we respond to our circumstances has so much to do with that.
Absolutely, yeah.
Well, we're going to be back with Dr. Victoria Kelly in just a moment. We have another question from a viewer, so stay with us. We've got more Your Day coming up after the break.